to our portrait of a food pantry visitor unveiling, data demographics and disparities. We'll go ahead and get started here. Hello, everyone online. Thank you for joining us. So most of you in this room and online, I'm assuming a little bit are pretty familiar with DMARC, but just to hit a couple quick highlights. We've been in the community for over 71 years now, 47 years of that focused on our food pantry network. We have 14 permanently placed pantries across the metro area, a mobile pantry program, and a home delivery program that we all kind of work together in this network to meet the needs across this community. We offer a 3 to 4 day supply once a month of staple grocery items across all of our pantries. And you can come anytime for items that are donated, food rescue, etc. The only reason we limit those other items is because we're purchasing most of them and we can just only stretch our dollars so far. Want to mention that our food pantry network is built on 3 pillars that are really important to us. The first is providing a dignified experience that's as close to grocery shopping as we can make it. The second is a commitment to providing healthy foods. We've done studies over time that have shown folks in pantry environments that struggle with health issues a lot more, and a lot of that has to do with the food that they have access to. So we try to provide access to fresh produce, lean proteins, really good things that sometimes are out of reach for them financially in the grocery stores. And then a third piece, why we're all here today, is a commitment to data. So at each of our food pantries, whether it's one of the permanent pantries, the mobile, or the delivery program, initially you go through kind of a set of questions. I kind of liken it to the first time you go to a Sam's Club or a Costco and you have to kind of go through the questions and enroll in the program, except we ask them a little bit about their situations as well. It doesn't impact their ability to get food. They can refuse any questions that they want to. We don't share any personal data that we collect, but we're looking at it and sharing it all in the aggregate. So there's a number of ways we kind of share this information throughout the year, this being kind of a big piece of it, but we do a lot of presentations with folks throughout the year. But wanted to make sure everybody knows that a lot of this information is available publicly on our website, where you can dive into kind of looking at things a little bit regionally. You can look at heat maps, a number of different things as far as the publicly available data to dive in and kind of see what you can find, and maybe it'll raise some questions for you that you want to bring back to us or spark something that we might want to work on together. So we started, this is the 3rd time we've done this report. And a big piece of it for me is we're collecting all this data. What good is having this data if we're not sharing it and trying to find actionable pieces out of this data? That was one reason we built that public sort of interface with the data, but it's another reason why we really wanted to dive in and share what we could infer from the information that we've collected to really inform some of the root causes that are impacting RSU, inform around some of the policy choices that we might be making or considering, and really try to make sure that, hey, this is what we know to be true. Everybody should know this information. One thing we get asked constantly is, so tell us what the typical pantry visitor looks like. I can tell you without hesitation or reservation, there is no typical pantry visitor. But if you look across all the demographics, and if we kind of, being Halloween season, built a Frankenstein out of what all the leading answers are among that, it would be a white non-Hispanic woman, someone who's graduated high school, looking at family size, they have 1 child, living below the poverty line, not receiving SNAP benefits, which I think is really interesting if you consider that they're living below the poverty line and not getting that benefit. They're in and out of employment, and they only visit a food pantry 1 time per year. So again, all of these things is not a single person, but if you look at the leading answer across each of those questions, these are the ones that come rising to the top. So just to kind of walk through a little bit of a timeline here, I've talked a lot about our getting into this building and the timing of it being pretty miraculous. We moved in here the last week of March in 2022. everything changed with SNAP on April 1st in 2022, and we started seeing a precipitous rise in need, both among folks who had been to pantries before, but really huge numbers with folks who had never visited a pantry before. And we're going to dive into some of that today. So that April, we saw a huge increase when folks lost those SNAP benefits that had been going out of maximum. Those continued to sort of supports from the pandemic era continued to wane, and we continued to see increases. Over this past calendar year, we've broken so many all-time records that it's just kind of a joke around here anymore. Oh, there's another busiest of all time. Every month was the busiest month of that month. Every month we had more new visitors than that month has ever seen. We were just looking at our volume yesterday, which had you taken the year out, it would have been our second busiest day ever. But now it's barely even reaching the top 10 busiest days ever. We've got this acronym that one of our board members came up with, BOAT, busiest of all time. So we're talking about all these BOAT situations. But it's just persisted. And so the data that we're going to present to you today is from our last fiscal year, so through June 30th. But we will also have a segment where we talk about what we've seen since then. Important, I think, to point out that this past August was a BOAT for us. It was the busiest month we've ever had. It's not slowing down. The number of new folks aren't slowing down. So there's a lot of things that we can point to as far as barriers and disparities. And what I really want to come out of sharing this information is that it sparks something in you in the room or you online or someone you talk to about this, that they say, hey, I think we have a role that we could play in that. We can do something about that. I want this to move from just being a report of numbers to how do we turn this into action that we can actually make some impacts. So what I'd love to do is be at this report next year and tell you, look how we improved this together, look how we improved that together, and be able to point to some of those things that this data made the difference in doing that. So please listen today with an eye towards, I think I could do something about that. And then come talk to us, because we definitely want to hear that. I do want to make a land acknowledgement, which we think is important. We acknowledge that we are located on the ancestral land territories of Bakoji or Iowa, the Sac, and the Meskwaki Fox people. This land was taken by force and coercion of white colonizers and government of the states. We wish to pay respect to elders of the past, the over 1,000 Native Americans currently residing in our community, and future generations. With that, I would like to turn things over to Blake Willitson, our communications manager here, and keep things moving. Thank you all for being here today.
Right. I'm going to use the mic. Test. I don't think it's on. That's okay. My mom says I'm a mumbler sometimes, so I'll try and speak. Welcome everybody. You might see some new faces here. I just started out this year at DMARC as our communications staff, so my work a lot of times complements a lot of what Luke is doing alongside in the policy and advocacy space. But in this past year, it's been extremely informational for me, being able to see how things have progressed in one of our busiest times ever in the history of the 47-year history of our food pantry network. So what I want to dig into with this report here is talk a little bit about some of the new findings initially here, some of the things that really stood out, and then maybe talk a little bit more about some of the things that are consistent that we've seen over the 3 years that we've been sharing this information. It might not be the flashiest or the biggest headline to say that, yes, this is staying the same for some of these demographic trends and the disparities that we're seeing. However, it's really, really important. I think one of the biggest takeaways from this report itself. So housekeeping, we do have restrooms south side of the store, water fountains. If you need some more food or drinks, feel free to grab anything as we're talking here. The report itself, the 40+ pages, is available online at our website, dmarcunited.org. So if you see anything that really trips your trigger that we didn't cover much today, or if you do have questions, again, feel free to dig into that a little bit deeper out there. So just starting off, we're trying to really track what we're seeing with new individuals over the course of this fiscal year that we're looking at. Every single month, we set an individual monthly record for the number of new individuals we saw. So for that respective September or October, it was a record. It was actually 14 months, so it extended a little bit before then. But as you're looking at that chart, I mean, just the entire swath of that, we were seeing a lot of our numbers rise because of those new individuals. So why is this happening and why does that matter? When you look at a demographic breakdown, a lot of the folks who are new to our food pantry network, who maybe have never visited a pantry before, found themselves asking some really tough questions when it came to the rising inflation we saw this past year. I think when you look at this being broadly a little bit less white and just a little bit more demographically diverse, that speaks volumes to who's coming to our pantries, as well as, when you look at some of those other factors when we talk about inflation. According to a report that was sent out by the Joint Centers of Housing Studies at Harvard, nearly half of the Des Moines metro is currently cost burdened when it comes to housing for renters. Excuse me. For the consumer price index, the cost of food increased 13.1% during this time period compared to the July previous. And, we continue to just see the cost of living increase over the course of that time when inflation peaked in June of that year. So that's a lot of what was driving folks to visit a pantry here at the Des Moines level. And you just see the numbers here. About 39% of all households that we saw during this time period were first-time visitors, as well as 32 individuals. The reason why that's important, if you look at the number of households, the average household size, that increased for us over this past fiscal year as well. Just when you compare those numbers from the year previous, you can see that a lot of people were challenged with coming to a pantry for a first time. Another really important key finding that stood out this year that maybe wasn't as big of a factor in years previous was the number of children that were experiencing poverty and were seeking out a food pantry being serviced by the Food Pantry Network had increased. And this is one of those areas where if you look at the actual numbers, maybe it wasn't a huge percentage increase. When you just look at the actual numbers of people affected, though, it makes a huge difference for those folks. So it was just a little more than 1 in 3. That was everyone that was assisted by the Food Pantry Network during this time was 0 to 17 years old. And those children tend to be a little bit more racially diverse than the broader population that we're serving. So that really just points to when we're looking at our community as it becomes more racially diverse, we're going to continue to see that trend ongoing. But if you compare this previous fiscal year to the current fiscal year, there's even quite a bit of a jump there in that respect. So I think that it was really challenging for folks who are first-time individuals, and that kind of is that in a nutshell. But when you look at, as we look at the demographic groups aging, so young adults versus seniors versus adults, like the seniors did not tend to move at all compared to the children with how we're tracking with this report. So that points to a couple things. One, we can be doing more outreach when it comes to talking about things like public assistance programs with maybe some of these folks that are thinking, oh, if I'm taking from a food pantry or taking food assistance, then I'm taking from somebody else. We want to dispel those myths and make sure that people feel welcome in our spaces, as well as just seeing if we can do more targeted outreach when it comes to those younger families. So I kind of teased this a little bit, and Matt mentioned it as well. I think one of the biggest takeaways from this report this year was the amount of consistency we did see with the disparities in demographic trends. So, and broadly, when you look at maybe a 3 or 4% change, why does that matter? We're talking about 60,000 people almost over the course of this fiscal year. Those numbers add up. So about 1 in 5 people who live in Des Moines proper during this time period were assisted by one of our food pantries. some of the things that really did stay consistent that are surprising nonetheless. So we tend to see demographics for women be a little bit higher for food pantry usage than men. That sometimes points to maybe there's some reluctance about seeking out assistance. A lot of the work that we're doing when it comes to some of this stuff is kind of myth busting, dispelling those myths and things that might be out there in the community about some of the disparities that we see, or why people are seeking out a food pantry, how do they come to us, what are those people experiencing themselves. And I think when you look at the gender disparity, it's pretty much even when you look at children, but again, as we look at those demographic ages going up and up, older in age, it goes from being a 5% gap for the young adults, so like 16 to 24, to a 16-point gap among seniors 65 and up. As well as just wanted to point out that when we look at the 3 out of the 4 visitors who are below the federal poverty line, a lot of those folks may not be qualifying for public assistance programs or not choosing to use those, so they're coming to a food pantry. Why does that matter? When we look at the white, not Hispanic population that we observed in this report, they tended to have relatively higher incomes than some of the other folks that were seeking out food assistance at one of our pantries. So that just highlights the differences that we're seeing and the realities that some of these folks are facing, and some of the historical factors that may be playing into that. Again, 95% of all of visitors were below 200% of the federal poverty line. And so that kind of just points to the contrary. We hear a lot of like, are people seeking out assistance that don't need it. This is just a really quick look at how many times people are visiting a pantry. We do get a lot of questions about, are you worried about people relying on food pantry? The vast majority of folks, about 49%, are only visiting once or twice during a calendar year. Another one of those things that just does not change from year to year when we're looking at these reports. And this is different for different demographic groups. So when we look at seniors again, 25% of everyone who used a food pantry 12 times was 65 or older. So that's another one of those things where we can point to and say, hey, maybe there's some room for some more targeted outreach. Again, most of these folks are living on a fixed income, whether it's Social Security or otherwise. They're less likely to use SNAP benefits, and so we want to provide a lot of really good choice options for folks at the food pantry level when you're coming in, and make sure that experience is applicable for anyone who has dietary restrictions, concerns. And then when we look at maybe specific groups that are impacted when we're talking about the number of times people are visiting, one thing that really stands out is the Asian, Native Hawaiian, Pacific Islander folks. 43.4% of those individuals were working compared to the average of 35% across our pantry. And 15.7% were stay-at-home parents or caregivers compared to about 5% across all of our food pantry visitors. Those folks tend to visit the food pantries more often, more frequently, and some of those concerns are lifestyle things that might be what's impacting that. Again, like when we look at these broad trends that continue, racial disparities across for food pantry visitors are consistent across the greater Des Moines community. We can break that down by city level. This is something you can take back to folks maybe when you're looking at the report and say, hey, this is what's going on in our backyard. We saw a 26% increase in the number of folks come to us from the Des Moines area, but when you look at just like the proportion of the amount of folks that were served compared to previous years, it's very close. Another thing to point out here too, when you look at just about 19% of food pantry visitors who identified as multiracial lived in the 50315 zip code. Here's just a quick look at Ankeny. Again, this was probably the biggest increase year over to year, 43% jump. And this is where you start to see a really big difference between the general population, folks that are being, and the folks that are being served by our pantries when it comes to demographics. Clyde is probably the biggest split when you just look at on the face of it. Folks who were living here were less likely to be white, not Hispanic, or multiracial, and more likely to identify as other races and ethnicities. Again, I'll let you kind of dig into this on your own time a little bit more, but this really highlights across all of these communities that we're serving here in the Des Moines metro area, it's pretty consistent. One last thing when we look at the demographic trends, so specific demographic groups, there's a lot of opportunity for us to be doing more to help make sure that they are not having to be as challenged with food insecurity. So when we see SNAP participation a lot lower for Hispanic and Latinx folks who are coming to our food pantries, that points to maybe there's some hesitation among, maybe it's not a specific law or change, but just a lot of the quote unquote vibes essentially when it comes to programs like this, where people might have some misconceptions about why are they asking for this information? What are the things that I tell them that might be used elsewhere? And so we want to make sure whenever somebody's coming to our food pantry that they understand that information that's being shared is confidential. And you know, this graph really showcases that split when we look at specific demographic groups, who's using SNAP, who's not. This is a really broad look, but it shows really well the correlation, what we tend to see when there are big changes to what's happening with SNAP public assistance programs and what's happening at the food pantry level here in Des Moines. I do want to spot, like there's been countless examples that we can point to where a policy change or a broader shift in what people are experiencing sends a lot more people to our food pantries. For this past fiscal year, there was some things like PEBT that was introduced for children and families, where we saw a small shift in less families coming to our food pantries. Like Matt had mentioned, I think this is really interesting one where you can look at the huge split here where max SNAP benefits ends, and then we see people coming to our pantries. That's really the foundation of what set up this record year for us, and really was kind of a powder keg before, as folks were entering that inflation new normal. Lastly, just wanted to close on taking a look at some of those racist housing policies of the past that continue to have an impact today. When you look at redlining, broadly, that was a racist housing policy that led to segregated neighborhoods and prevented generations of Black families and other communities of color from building wealth through home ownership. So essentially, you know, we look at when you compare people that are coming to our food pantries and people who were affected by this policy living in these areas today, the C and the D tend to be those areas that were split off and more neglected. And you can see that even when you add in people who live outside of Des Moines proper, that is a huge chunk of the population of the folks that are being served today. And it really points to the fact that these, while they weren't necessarily unintentional, they do continue to have a huge impact on the work that we're doing today. And a lot of the things that we have our eye on when we look at areas of opportunities and things that we can change and do better today and working together, they are system-based approaches. So I think it's important for us to note that as we look at this data, it can be a little overbearing, a lot of the challenges that are ahead of us. But we can still keep that vision of a community where everybody has access to food, a real possibility. And there are some really simple changes, whether we are doing it at the local level here or beyond, where I think that vision is possible. When you look at the advocacy space, we've been doing a lot in this past year as I come onto my role, and Luke has more time focus on that entirely as a full-time staff. So, you know, if that's an area of interest for your nonprofit, it's again one of those things that we'd like to showcase the roadmap for how we got here and what we're doing now. Some of those examples, we've got our eye on continue to advocate for some of these priorities you see here. with the upcoming negotiations with the USDA Farm Bill. We created work groups, storytellers roundtable, where folks who may be experiencing food insecurity, who have experience with it, can get the tools to learn how to share their story, whether that's in a broader way, talking to friends and neighbors and getting them involved at an advocacy level, and then just giving them the tools to learn how to navigate, maybe talking to the media or coming to an event like this and speaking. We looked at opportunities around partnership and outreach. One of our biggest areas as we look forward is how can we take what we're doing at the food pantry level and provide more one-stop shop opportunities. There are a lot of people coming to us where there are other services or other things that are in mind. The biggest challenge for them might be time. And so we've kind of built a Southside coalition of area businesses and nonprofits that we call the Corridor here over the past year, and been doing some events where we're inviting folks in to learn about resources like jobs, opportunities for other income-based assistance and other things that are just available here in the area, and working together so that it is less trips, easier for folks who are in these situations. And we continue to create other ways to address some of the biggest challenges to the work we're doing at the food pantry level. One of those things is creating a statewide work group around the implementation of Senate File 494, which will kind of have an impact on qualifications for SNAP and the process for people enrolling in SNAP. That's not currently being implemented, but it is something that as we look at down the line, being ready for those changes and for maybe those folks who are being affected by that or changes at the federal level, so that we're working together to make sure nobody gets left behind. You look at our services, again, I mentioned some small things that you can change in just the day-to-day experience at the food pantry level, but we introduced a brand new food pantry here. If you want to stick around after the event here, we're going to do some tours if you haven't seen the space. It is really neat to see in action just how much, with the change over the course of the past year, what we've done to adapt to the number of people that are coming through our food pantries. And some of those small things to provide outreach to maybe the communities here on the south side, like providing more culturally specific options. We provided 25 pounds of rice that have been extremely popular because that is a great thing for a lot of the households that are coming through. That's just a small example. And then, we continue to capture the data that we're seeing at the food pantry level. Wanted to use that to break down additional barriers, make sure that people's time and efforts to make it to our space are being spent wisely, and then just finding other ways to collaborate, whether it's like Drake University and trying to capture changes with things at the food pantry level. Again, Matt hit on this a little bit, but we can't do this work alone. One of the biggest things that we can do with taking this data and putting it into action is how can we create those partnerships or just find a place where our work rhymes a little bit. So some of those biggest areas of opportunity is, can we find ways to share data? Can we find ways to tell that broader story of poverty and provide more outline to those folks as to what we're seeing at the community level? Can we provide a better framework for how we implement that data? Providing systems-based approaches is something that we've really put a big focus on with our strategic planning here at DMARC, and we want to make sure that if other people have questions or are wanting approaching that advocacy work, that they understand how to do it. And again, putting a huge emphasis on storytelling. We've got all these numbers. How do we tell those stories that complement those numbers and make sure people understand when we're talking about seniors, when we're talking about Latinx folks, we're talking about these specific demographic groups that they know the people behind the story. So we want to make sure that, if you know somebody who's been in this situation, that we continue to tell those stories in a dignified and collaborative way. Again, I mentioned you can find the full report here. I think at this point, we're going to try and break out into some small groups. I'll pass it off to Sarah Trome-Garriott here, who leads up our interfaith work. We'll have some time for questions following this, but if you do want to kind of kick that off here and talk about how we...
Great. Hi, everybody. I'm Sarah Trome-Garriott. I work with all the faith communities that support the Food Pantry Network. I end up doing a lot of the educational presentations out in the community. So keep us in mind if you'd like someone to come talk to your staff a community group, any kind of gathering, we're very glad to come and visit. This data is really important to my work to be able to share what's happening in our community. So for the next funds that they wanted to share, just go ahead and raise your hand. Any surprises that in the report? No surprise. Oh,
What stuck out to me was 3 and 4 visitors live below poverty line, so we talk about 250% of the poverty line and less, and that's 250% what you need for self-sufficiency. So a lot of people who are in need who are not accessing.
So one of the surprises is to talk about, having 3/4 of the visitors living below the poverty line. That's really, really poor. You need 200 to 250% of federal poverty to survive, to pay for your basic needs. All right.
One thing we talked about was the fact that there's a large percentage that only visit the pantry one time a year, and wondering why, what brought them that particular point at that point, and why did they just go one time? And then also, we were talking also that this data only represents as part of the whole system here as far as feeding people who are hungry within the Des Moines area. So
Yeah.
there's just a lot more.
So a majority of folks only visiting 1 to 2 times a year, what is pushing them to need to come to the food pantry network? We have that question too. And then also, this is only a piece of the picture. This is only the folks who are coming to our food pantry network and checking in for the healthy food supply. There are people who come to our network who don't check in and just get anytime food without checking in, or they don't come to our pantry network. They're going elsewhere. We don't have that data. Anything else? Questions?
I also question you 1 or 2 times a year. I have the opportunity to work from the pantry once in a while to help out. And I've heard a lot of familiar faces each week that I know there. So that figure kind of surprised.
Okay, so you're seeing people that you recognize coming back, but the majority of folks come 1 to 2 times a year, but in certain populations, we see that number being pretty frequent. Like for older Iowans, we see the average number of users, 5 times a year? Is it higher? Off the top of your head?
Yeah.
It's about 5 times a year, which is a lot more frequent for older Iowans. Yes.
Well, I have a question too, that we could answer. I'm a volunteer in a food pantry, and our people, it's very busy. They are very disappointed that there's rarely milk, there's rarely eggs, and meat supplies for eats, and that's what they really see. And I'm wondering if we can improve that situation, or what caused it. If you said it.
Yeah, so there are a lot of folks coming to the pantry seeking items like dairy, milk, eggs, and fresh frozen meats. Those are items that are definitely more expensive, harder for us to source. They're not always available at every pantry, but that is the most desirable. So how could we make those items more available?
I was curious how many of the people that utilize the food pantry are employed.
And let's see, how many folks using the food pantry are employed from the report?
I think one thing we can point to is that the majority of folks are in and out of employment.
There's different categories of employed. Seasonal workers, part-time, caregivers for another family member, or maybe waiting on disability. So.
I think another thing to keep in mind there is 33% of the population's children. So right there, 1/3 of your universe is not really workforce. When we look at sort of the unemployment level, it's usually somewhere between 15 and 20%, and it kind of varies month to month. But the notion that food insecurity is being driven by people not working is bogus.
Yeah, we were discussing also, in addition to employment, the role of childcare and either childcare costs contributing to a need or lack of access, maybe preventing accessing DMARC resources. So that was another question that we'd be interested in hearing about.
So we've had questions about employment. It's usually a pretty low number of our working eligible population that are unemployed. fully unemployed, and then childcare, how that might impact the numbers of folks that we're seeing come to the pantry network. Yes.
You're a good one to answer this question. Why does our governor and legislature people to apply for SNAP? And as the man in the blue sweater said, it's bogus. But we put more requirements, have to be actively seeking employment, able-bodied, and if you're not seeking employment, then you don't qualify for SNAP. What is the feedback you hear in the legislature?
Yes.
Making it more difficult for people to apply SNAP.
So the question is, why is our state government making it harder for people to apply for SNAP? Not everyone in state government is trying to do that. Many are speaking against. Many are speaking against it, but there is this idea that somehow food insecurity is a sign that people aren't working, or that somehow food access prevents people from going out and getting jobs. And so it's believed falsely, without any basis in fact, that if people are just cut off from food assistance, that they'll all flood into the workforce. When in reality, a large number of the households who are receiving SNAP benefits have someone in the household who's working. That's the vast majority. And so many of the folks benefiting are older Iowans who are beyond retirement age, people with disabilities, folks who are children under the age of 18. So we're always working to challenge those stereotypes and misperceptions. And those are pretty deeply rooted, and so it's kind of hard to knock those out. All the data doesn't really make a difference, but sometimes it does help for lawmakers to hear from people in their communities who are benefiting from SNAP, because we have an equal number of folks in rural communities and urban communities who are receiving SNAP in our state. And it's really important for them to know that their neighbors are benefiting from this program. And we're going to see the impacts of this change when they go into effect in 2025. I know we've got some folks in the.
Yeah, there was a question about looking at those people who are visiting once or twice a year. Are there specific months that those visitors utilize the pantry?
Are there specific months that we see those once or twice a year visits? Do we know?
I can feel that. Yeah, I'll talk a little bit more in depth about this, but the vast majority of who we see that's only coming once per year comes around the holidays. Mostly November. November is typically always our busiest month by day. So it's whether it's holiday expenses, there's all sort of anecdotal stuff we've heard from people, but most people that are coming once, twice a month, that's driven in because they have costs going elsewhere during that time of year.
Yeah, and so we're not, we don't necessarily ask questions that help us get at that, and we're trying to think of ways that we can find out a little bit more about why. What are those factors that are pushing people to need the food pantry or need it as often as they do? We need to move on to the next part of our program, and so Daniel, come on up here and introduce yourself and share a little bit more about the data.
Yes. Okay, so I did forget my name tag, I apologize. I'm Daniel Beck. I do data analytics program coordinating with DMARC. We've kind of touched on a lot of the important data points. I'm gonna expand on some of them, answer a couple questions a little bit more in depth that we've heard talk about already today, and I'll repeat those. But then just kind of talk about the future, kind of what we've seen thus far. This data, the report that we've been talking about so far goes through the end of June. We're doing this fiscal year, so July 1st, 22 through June 30th, 23. I will lead by saying we do often get questions about predictions. What are we seeing down the line? In some way, we've gotten really good at predicting. We sort of know we can anticipate even daily, weekly, kind of the volume we're going to see. Demographics, as it's been alluded to, a lot of the demographics we see don't change too dramatically. Day by day, week by week, etc. Unfortunately, the difficulty in this is because of the pandemic and because of added SNAP benefits and everything during the pandemic, we don't really have a great baseline with which to work from since basically 2019. And even then we had, 2018, 2019, a 1 month-ish government shutdown that led to some oddities for a month or two as well. So we're sort of creating a new baseline right now. And that's kind of been the inherent weirdness about the last, 15 months-ish so far. I will say since July 1st, we have seen, basically just broken precedent over and over, records that have fallen, whether it's daily, monthly. Matt talked about this a little more specifically yesterday, which, yesterday was the 7th, I think, open day of the month. Typically, we're waning a little bit for the monthly volume as that goes on. Well over 1,500 individuals went to the Pantry Network yesterday, which before this calendar year would have been, our busiest or close to busiest day of all time. I say these things over and over. We talk about data monthly because I don't want to develop a callus about what we're seeing. Like I looked at this number today, over 1,500 people. I'm just kind of, okay, well, yeah, report that out daily. But having to try to keep in mind that those are records before this year. So that being said, we are approaching territory that we've never seen before. Matt talked about this. August was our single busiest month by volume, by unique individuals of all time. To add a little odd context to that, September was our busiest month by day of all time. And when I say that, just means August had a few more open days than September. So we saw more individuals by day in September than we did in August. The reason I bring that up is because we're close to 21 days from November, as hard as that is to believe. We're heading into the busiest time of year. We kind of know full well what's coming. I just talked about the people who come in November only 1 or 2 times per year. We're fully anticipating November is going to be another record by open day, maybe by total. It's 19, 20 open days, fewer than like August, for example. But it's frightening for us. I see some people that work at some of the pantries around here. It's frightening for them. And unfortunately, we setting this new baseline, we do just kind of worry that this is going to be the normal. Just to give a frame of reference for the 12-month runs that we're looking at, the fiscal year set an all-time record for the most unique individuals in a single 12-month span, which was just a shade under 60,000 unique individuals. We are nearly at that for the calendar year already, with half of October, more or less, November and December remaining. So that record is going to go down in the next, couple weeks. And that is also the unique total is something I talk about that a lot because it's really like the apples to apples comparison when we're talking about data going back to 2017, 18, 19. However, I do want to touch on, and this is really in depth when we talk about like different pantries sort of doing repeat volume, repeat services in different ways. But in the last year, we have also, some of the pantries in our network have signed on food bank via addendum that allowed in some cases repeat services. So when I talk about August being the all-time record by unique volume, we broke the all-time service volume record long ago, or way earlier in the calendar year, actually April. So we've been setting volume records month after month this entire year. Going up through current October so far looks like that could be another record follow. So it's not just unique total that we're talking about. At this point we talk about 20, 21, 22,000 unique individuals per month. It's more like 26, 27, 28 total services that we're seeing. So that volume is just going up and up and up. One of the questions we did get a comment that we were talking about with anytime food. This is unfortunately like the blank spot that we have that we're sort of trying to figure out how can we incorporate data that more accurately tells the picture of sort of food insecurity or hunger overall. Because we do have people, like anybody that's worked volunteered at a pantry knows about the anytime food. We have people that check in for certain items, but maybe don't go through the actual, like the quote intake process, the check-in process. What we don't know really is if we do 60,000 people last fiscal year, was the actual total that got help 63,000 or was it 80,000? We don't know that number, and that's kind of a major stone that we're trying to unturn. Something we want to solve. How do we calculate this? How do we figure that out? Because it does tell the full picture. We know unique total in the last fiscal year, we helped 1 out of every 5 people in Des Moines. Realistically, it could be 1 out of 4. It could be a much higher number than that. So we want to tell that story in a better way. On the question about employment, it's one of the things I frequently talk about over and over. Obviously, employment varies, week to week, month to month, employment levels, unemployment. The thing that I always talk to people about is the number of individuals in our network that are underage, they're 0 to 17, over working age, sort of that typical 65 plus cutoff for like employment. So minors, seniors, on disability or working is the vast majority of our network. It's the most common myth we've had to dispel over the years that, whether it's, whoever we're talking to, it's a question we usually get: what is the employment total? What's the unemployment total? The vast majority, typically in the neighborhood of 80+%, are in those categories: below working age, above working age, on disability, or working, period. And the vast majority of households have at least one working adult. Again, Matt, sort of, we've talked about this to some extent. It's looking over the data on a daily basis, and kind of like one of the last things I'll talk about, and then happy to answer any questions as well. 3D report, the third time we've been doing this, it's looking over the data daily, weekly, monthly, yearly even. It's extremely interesting. Since I'm always trying to sort of look for an answer, like what changed this month compared to last, or this year compared to last. It is odd to create these reports, to hear them, Blake and Luke and whoever talk about these, and see that, for example, during the pandemic, our numbers went way down because people were getting more assistance. Like it was a little bit paradoxical for people asking us, like, your volume must be huge right now in 2020. No, it's pretty significantly down. But when we see 24,000 fewer people in a fiscal year compared to the most recent fiscal year, but the demographics stay virtually identical, with very few, with some exceptions, obviously, like minors increasing, etc. It does, I won't say it gets frustrating, but it gets to the point like I want to be able to look and see, like, this is the cause of like why we're seeing this increase, whether it's our pantry or elsewhere. New individuals, again, alluded to the record numbers of new individuals, which is hard to explain at this point. It's one of the things we look at right now that I don't even have really an anecdote for what's causing that. We know the situation, we know about inflation, underemployment, etc. But at some point, we keep thinking, like, every month, like, we've got to hit a cap at some point of the record number of new individuals. We're always going to see high numbers, but at this point, 16 out of the last 17 months have set records for new individuals of that month. That's a little bit of an odd stat. But all it really means is month after month after month, we keep setting new records of new individuals coming to the network. And every month we're like, maybe this is the last one. And 5 days into the next month, oh, never mind, no, it's not. So trying to get answers for that, trying to get answers for anytime individuals, like how do we figure out sort of what the true scope looks like, rather than just this sort of pocket of data that we can't tell. That's kind of what we need to solve in the next month, and then in the next, year. Any questions coming in? Any questions in the room? Yes.
You mentioned housing policy, which I was glad to see. Do you have a way to track people's address stability, folks, how often?
Yes. Yeah, so it's not, I will say it's not as often as people think. There is definitely a fluidity to the households. The question, let me repeat, was about address tracking, basically address fluidity. How often are people moving or not? The network is fairly static. Like there's definitely fluidity to the households, especially like minors coming to different households, going, from one parent to another, grandparents, friends, aunts, uncles, etc. Addresses largely remain static. Again, we're working right now, 9-ish% of every single person that comes into the network, like in last month, is new to the network. So those, of course, we're adding, but once somebody's there, it's actually only like, the average is about once per year that somebody's changing households. And it's a question that I get really often is like, why do we, can we not ask about X? In this case, like, can we not ask them why is address changing? Can we not ask them why, like whether they consider themselves stably housed or not is changing? Again, this was alluded to slightly in the earlier part of the presentation. I kind of joke about this, like, we're trying to walk this sort of knife edge with our intake about, we want to get adequate, meaningful, viable data that we can sort of look at systemic issues. But I also don't want it to get cumbersome. I don't ever want to ask any question that's going to scare anybody. Like, the most frequent question I get is, why do we not ask about, like, what's preferred language or something? And I would have to think, like, could this be interpreted in some way that somebody's going to think we're discriminating against X? Like, so I never want to ask a question that feels too invasive, but we're still getting data that is, again, meaningful for what we can tell.
One thing I want to add on top of that, we know a lot about what we know. We don't know a lot about what we don't know. So like in that negative space, we just ask questions, So our is part of that only coming once or twice over the course of the year because people are moving and going away? Did they come while they were here and now they're gone? There's as much that we don't know as that we do know.
Yeah. Yes.
Do you or can you ask those people what brought you to the food pantry?
Yeah, it's one of the most common questions we've been sort of kicking around. Like, what's a phrasing that we could use to get that question? The question to repeat is, can we ask essentially why somebody is going to the food? Like, what's the reason? For example, like I get the question commonly, if somebody's only going once per year, like what drove them to that one time? We know anecdotally, like I said, it's holiday. The issue lies in that we can think of ways we could ask that question that it would be a meaningful statistical answer. What scares me is, how do I get 8, 9, 10,000 intakes per month to ask this question in a way that it might not just come out as, why are you here? So like, I don't ever want to ask a question that feels like they're like, oh, I shouldn't be here. No, so we want to ask the question in a way that says, you came this time where you didn't come the rest of the month. Can you explain what led you? Something along those lines of diplomatically asking what drove you to the need this month rather than, no times in the last 6, 7, 8 months. It's really, really tough to make that question not scary for that many people. Yes.
Aren't you getting some of that in the stories?
Oh, yeah. Yes.
Yes, that's the best way
Yeah.
to get some of that
Yeah.
information, is tell us your story. And in those kinds of ways, it doesn't seem so targeted, like, why are you here? It's like, share with us, what we provided for you or how we.
And to say 9 out of 10 times, somebody who's calling us asking about, hey, I would like to use pantry, or I don't know what's out there that's available, but I need help with food. They're telling that story before we would even ask it. A lot of times they feel like they need to qualify that, share that information. And so with the way that we do our service delivery model, we don't want to make sure anybody feels that there's any pressure to qualify for our services. And so that's very key to your point, Daniel.
Yeah.
I think we can infer some too, to a pretty high degree, from the other questions we're asking them, what their responses to those are. It's not perfect, but some of it tells you a pretty obvious story.
Yeah. And a lot of, when I talk about anecdotes, a lot of what we do know is, at times we've done, whether it's survey work or something, very controlled, very small data sets where we can sort of extract or extrapolate from, 50, 80, 100 cases. Yes, we do know this example, but again, just like I said, that knife edge, we're like, I have to consider all the time what could be perceived as frightening or discriminating, and avoid those things. Yes.
I just that we have realized we had over 200 people doing intake. And so while we might be very sensitive to that question, the idea that everyone that's doing intake is and so we're really careful about how we train people. And is very careful about that. But we also are very careful on how we create questions.
Yeah, there are a lot of questions I'd love to ask, but some of them we just can't do it. Just getting ready for more questions. Oh,
Is there anything online?
Nope, they're coming in.
So we've solved everything, everybody has a. Okay, good. Sure. Yes.
Listen. So much. So I'll go home and read the report. I'm gonna watch again online this session, but wondering if there's a possibility of setting up more conversations, even if they're virtual, so that we can help you. I mean, you had a whole list of wonderful things, but how can we be a supportive community to what DMARC has put before us? We need your guidance.
Sure.
to
I
be
think
achieved.
one thing that we're going to try to do this year that I don't think we've successfully done in past years with this report is try to kind of keep a monthly focus on a piece of it each month that we want to talk about and build a broader communication and conversation around. So that this isn't a one-day thing, but it's teasing it out through the course of the year. And as we continue to collect this data, we can talk in those conversations about how it's changing, what we're seeing now, what maybe some of the new challenges that we're facing are that maybe didn't show up in some of this data, but are showing up today. To be able to have this be more of a living, breathing thing than kind of a, all right, here's where we are, see you later.
Your ability, and we have it because you've done it for us, provide regional neighborhood type data.
Oh, yeah.
For example, we're trying to join forces, churches in our immediate neighborhood to serve, and several of us have little food pantries on the curb. Well, if we can't even keep those stocked for a day, we know there's a problem in our neighborhood. But if you have even more data, I mean, how can you help us to?
Sure.
That
So one thing that you didn't see today, we can take all of this data and plot it on a map. So we can take kind of bubbles by household size. It'll put it on a map, show you kind of by zip code, by legislative district, supervisor district, what have you, what the numbers and demographics look like in that area. We can draw a circle on that map and say, here's what this circle looks like. So we can go to like Karen's church, put a pin in it, make a mile radius around it and show here's what's happening a mile from where you're at. Look at some of the other things that are in that area that might be opportunities for collaboration. The thing that's tricky about that is we can't just have it publicly available. It's super complex to run it. So we have to present it to you, but we are available to do that on a regular basis. We have a number of people on staff that can run through those things. We'd love to come out to groups, churches, what have you, to talk about those things, see what questions it generates in you all, to get to those conversations about, okay, what can we do here? So you can focus on a circle. Okay, we've got it here. What can we do here? Okay, what can we do here as we get to more broadly trying to actually solve these problems? Yes, sir.
Another response to her question, what can we do? Volunteer at a food pantry. Talk to your neighbor or talk to somebody that lives close by. And then you feel might qualify to go to the food pantry, but may not be going. Those are two suggestions of things you could do.
Absolutely. I think another thing, just generally, make it okay. Like, people shouldn't be embarrassed to use this assistance. People should know that it's here for them. Help share some of the data that we share with you all with folks. When you hear them saying something you know not to be true, challenge it. Sometimes I feel like the in certain situations I'm the little Dutch boy with his finger in the dam, and I'm like, why is no one else pointing this out? If you know it, you got to share it, especially when you hear the stuff that's not true. And we hear a lot of stuff that's not true on a regular basis. Try to connect with people that you know that are facing these situations. Try to make it okay with them too. Share what you're seeing and that you're supportive of, making sure they have what they need. This is just about the human condition and supporting each other at the end of the day. And if we're not doing that much, we're doing a lot wrong. Trudy.
Matt, we're 9 to 11 months into working on the improved collaboration between food bank and food pantries. Is there anything happening there that maybe is responding to some of these hard questions that you have? One, and two, how is that progressing?
I think the relationship has gotten a lot better, obviously. The sort of analogy I make sometimes is, imagine you broke up in a relationship and now you're coming back to be friends again, and you have to deal with some awkwardness and getting through that and kind of rebuilding trust with each other. And I think that's where we're at. But we're working regularly together to try to ask questions about things that we're both facing, try to challenge assumptions on both sides of things, and see where the commonalities are, see where we can make exceptions to rules where they don't make sense, maybe completely. I think we're at a point now that we're about a year past where we can start assessing the impacts that some of these changes have had. We have had some of this increase is due to the new sort of contract structure, and we're getting through it. I think our sort of on a monthly basis, the number of folks that are coming to one or more of the pantries, whether they're going 2 or more times, that number is steadily rising. It, kind of started around 6% a month, 8% a month. This last month, we were up to 15% of those folks who came to a pantry came more than once. So I think there is a point at which that becomes unsustainable for us. We're not there yet, but I feel like we have a table to come to together to talk about that situation when we're ready to have that conversation about, hey, this has gotten too hard for us. That'll be met with open ears, and we can have a conversation and not just kind of fall back on an agreement. So I feel like we've improved our relationship in that regard, that we're having these conversations and it's not sort of based on signatures on documents.
Thanks.
Man, related to like the eggs and milk, I mean, a lot of that was surplus government, is my understanding. A lot of it, has that kind of dried up, or is now we have to pay for it all and that's why there's less? Or
so the question was about this kind of scarcity of dairy, meat, the eggs, those items. It's a multifaceted situation. So the first piece of it is we're able to do what we do on a monthly basis because we're buying stuff in such large volume, and we're getting dates on it that are good for a year and a half. So we can get something that would maybe in the store cost you $1.50 an item down to 60-70 cents an item. We buy a lot of it and then we store it and work our way through it. You can't do that with milk, dairy, those kinds of things, because the shelf life is just too short. So from a cost perspective, we can't get that cost down on those items where we can buy enough of it to be able to feed the whole network. The amount of that food being donated is scarce. I think some of it comes through USDA programs that, for our partners that are partnered with the food bank, you can access those through the TFAP program. That's really helpful. But there's just not a ton of donated items that are dairy, eggs, and meats. And when they are, it's like, okay, we've got some milk. You've got 3 days left on the shelf life of this. So then it's a scramble we have to get this all out and people have to drink it right away. And that's not how lives work. Like, you don't get a gallon of milk and drink it today. So it's trying to figure out, how do we build that buying power some? How do we get more of this donated sooner? Because it's really tough in the dairy and egg space. I will say with meat, with the size of freezer capacity that we have now in this building, we are able to buy enough that we can get the cost down on it to where it is affordable. We've had a lot of success with ground meats, whether it be beef, pork, chicken. We've gotten some really good pricing on kind of bone-in chicken, whether it's chicken legs, thighs, those kinds of things. So we have made a lot of improvements with getting meat, but the dairy and egg side is just so difficult. Yeah, true.
this may be such a small, percentage of people, but I was with to have an impact. I was with a dear friend yesterday and was reminded that he has chickens in his yard. I mean, I know there's lots of people who have chickens in their yard. Is that ever tapped? Is there any way that some of us could work on how could that ever be utilized as something helpful to the pantries, or are the numbers just so small of them?
It's hard at the size of volume that it is. Where I think it can make an impact is going directly to pantries with those. Where, you know, maybe a house can get 2, 3, 4 dozen eggs and maybe can split that into half dozens. And then that can go out to, you know, half a dozen households that come through in that day. But when we're seeing 1,500 individuals a day, I mean, the numbers that we're talking about are just really, really high. And with the perishable items, it's just really hard to have enough of that to be able to move it in an equitable way, which we would try to do at the volume we have here to spread it out across the pantries based on the volume of folks that they're seeing. So with things like the sort of backyard animal husbandry, you know, that stuff, I always tell people, find the pantry that's closest to you and take it directly to them, because they'll be able to move it right away and it'll get out that day. I think sometimes we get caught up in this idea of, I need this thing and I need it like this, and that's how it works for me. Trying to find the other niches out there, like it's very much it takes a village sort of story. We've got these community refrigerators out there that are filling a gap for folks that can't or don't want to come to a pantry. There's a program run by Zuli called Knock and Drop for the Latinx community who maybe will not want to ever put their name on something in some of these places for a lot of reasons. Where she's helping to fill that niche with that community. There's all these little pieces, and it takes all of us working together to kind of complete the picture. And no 1, no 2, no 5 organizations can cover this all completely. It's way too complicated, and there's just way too many little gaps. Where especially if you're looking at large volume like we are, there's a lot of those gaps we'll never have the capacity to fill because it's just too small a piece for what the squeeze would be for us. There's not enough juice. So for me, it's all about how do we work as a system together to fill all those gaps where, you know, the person who has eggs in their backyard, they're contributing to. Yes, sir.
Is it feasible to negotiate with providers like AE that would enable you to provide vouchers to individuals to buy milk at a discounted price?
Becky, do you want to take that question?
I would love to have that opportunity. Okay, I haven't experienced that opportunity. We have a few of the pantries that work things out for like holiday meals and things, but it also would still be a very high expense. Compared to the other individual items that we provide. And unless we could do that for the entire network, you know, because we try to keep everything available to all the pantries so that right. So I can't even imagine the price tag on trying to provide dairy even once a month to every one of our pantry visitors. Maybe somebody else can do that now.
If anyone wants to start a dairy.
We had a question come in line about plant-based protein alternatives to meat.
Yeah. I think we've been seeing a lot more of these. I know we've seen them in our pantry here. And a lot of that's coming through our food rescue donations. Anything you would add on to that, Becky? About plant-based foods?
I've been trying to do more specialty items, so when I get the opportunity to buy things like tofu, I do. It's not always available on the wholesale market at our price point that we need. Also when there's gluten-free pasta or you know, rice noodles, that type of thing, I try to focus on those. We've had plant-based meat alternatives in the pantries. And I have actually done some purchasing of some of those items because they are fairly reasonably priced, actually on the wholesale market sometimes. So we try to provide as much variety as we can to help as many people with dietary needs and restrictions, or just making that choice as possible.
You mentioned food rescue donations. Could you explain that a little bit?
Sure. So food rescue is really getting items donated, whether it be from a retailer, a producer, someone who, instead of selling that food, is ready to donate it to us. And so we have a system where we go to a number of stores and pick that up, and then we move it across our pantry network. A lot of times it's really great things like prepared sandwich. We work with a lot of convenience stores and they'll have a lot of prepared sandwiches, like shortcut fruits and some of those things, a lot of produce. And those are the things that we try to have available in those anytime items, because again, with those, there's not a big cost implication on us for being able to provide those, and they tend to have a shorter shelf life. So we want them to move right away.
Yeah. You all were drinking today. We're all food rescue. Okay, they all came in and there was like bottle missing out of the case, or the plastic wrapper was torn. And so we get all of those items that we put those out into the pantries for people to come and just see what's available. And it's anything from beverages to produce to canned items to a package of diapers that was torn up.
And a lot of bread. Yeah, sir.
We're involved with Franklin Library, Moline, they have a food pantry. Operates as you walk into the library. From your perspective, have you been able to evaluate, is that worthwhile, beneficial? What's your reaction to putting food pantries in Des Moines libraries?
I think you got to try to meet people where they're at, and that's kind of the broader story behind, you know, why I was saying about we need all these little pieces that are doing their part, because the biggest resource that we don't talk about people not having is time. Like, people need to fit this into the course of their day the same way we fit grocery shopping into the course of our days. And again, I think it's this notion that, well, none of these people are working. No, it's not true. And you want them to work, and then you tell them they have to work, but they need to make 8 appointments a day to get all these things. How do you want them to do that? So I think the more we can have things kind of available across the community, even if it's small ways like the little pantries or the refrigerators, just creating different access points for people that are meeting them in the places that they're going to be. What we try to do with our mobile program is go to built-in audiences. So we do the DART bus station every Thursday. There's people there already. It's through the course of their lives. Now they can grab some food while they're there too. We try to hit congregate meal sites. They're already there to eat. Now they can get some groceries to take home too. We try to be smart about get it to where people are. Don't make them come to us. So I think, you know, every opportunity we have for putting these resources across the community, we should be taking advantage of.
Yeah, so those are some.
Speaking of DART, I had to come in a couple minutes late, so I apologize if I missed anything key there, but is there any relationship that would involve maybe a free paschal from a pantry, or is there anything like that I don't know about?
I know DART has a lot of programs where they work with different organizations to provide those free passes. I know we've gotten them before in the past. I'm sure we'll get them again in the future. I think Dart deserves a lot of credit for trying to connect folks that maybe can't afford the rates of the bus travel to make sure that they have access to that transportation. They have new leadership at Dart who I've not had a chance to connect with yet, but who I know from past things that we've done together. So I think there are opportunities there for sure. Trudy.
I wonder, is there a noticeable decrease in fresh produce in a couple of weeks when the downtown Saturday market ends? And in the summer, does that really balloon the availability of fresh stuff?
It helps a lot. So for those of you who don't know, on Saturday mornings at the downtown farmers market, at the end of the market, we have volunteers come down and we go kind of booth to booth and collect things that they're willing to donate that they didn't sell at the market. And then we take that back and then move it out across the food pantry network. It helps defray the costs for us on produce because we're making sure everybody has produce every week. And the way we do that is we buy it. So to be able to have that to help defray those costs is really helpful. The other thing that the freezer affords us beyond meat is the opportunity to buy frozen fruits and vegetables and not just have canned items. So especially in the winter months, we can get those. And one, it's a better value because you're not paying for the water or juice or whatever's in the can. And it tends to be a little better for you than what you can also. So it's sort of a twofold benefit to us to be able to do that now that we have the freezer capacity to do it. Well, I want to thank you all for coming, for being engaged. For anyone who wants one, we'll do some tours here briefly if you want to hang around for that. We'll have a couple folks that can take folks around. Otherwise, we'll have many of our team members here if you want to talk about anything with any of us, but just really appreciate your interest. Thank you.